While we wait for them to get back into the testimonies and hearing from witnesses on the stand, let's go to a story here locally now in the Charlotte area, as Novant is bringing in some artwork, a program now designed to help heal some of their patients. And our Emma Corinta talked to someone at Novant about this new program. This is previously recorded here on WCNC Plus.
And it's now been a week since the A Slice of Life, Art of Everyday exhibit opened at Novant Health Presbyterian Medical Center. Can you just tell me a bit generally about what is featured in the exhibition?
Yes, there are 28 pieces featured from artists ranging from school children to professional full-time working artists in our community. We have oil, watercolor, photography, mixed media, all works of art that are either framed or placed within our cafeteria space at Presbyterian Medical Center. So where we get a lot of visitors and people spend a good amount of time and are able to view the art.
Yeah, I got a chance to see some of the photos, and it's really wonderful to see it all come together. What's the initial reaction been over this past week?
It's been really positive, and I think one of the best parts is that when people take time to reflect, they start to tell you how these pieces of art remind them of stories of care, or how one of the artists shared that he was so excited to see his picture up because his mother had a stroke and had been treated at Presbyterian Medical Center. And so now to see this piece in a place where he had sat kind of quietly and trying and contemplatively, to now see the brightness and the color in that same space was really inspiring to him. So it's been a positive reception. On that first day, we sold over 20% of the collection, all proceeds going directly to the artist. This is just an opportunity for the artist to display their work and to kind of inspire our patients. But yes, it's been a really successful start.
That's great to hear. With the artists involved, I know you mentioned it's some professional artists, some students, some children. What was the process like working with artists of all different walks of life on getting their creative process to life?
So it is so, the interesting part is we just had to open up our doors. There are so many creatives doing amazing work within our community that we put the call out with our arts partner, the nonprofit Charlotte is Creative. And in just a couple of weeks, we got over 300 submissions. So it was more kind of deciding from all of the folks who are excited to be a part of this show what fit and what we could fit in to our cafeteria. We thought, oh, maybe we'll do 15 to 20 pieces. And then we were at almost 30 by the end because there were so many amazing submissions. So it was really just finding things that brought life. We have, there's one large painting of a young man. He's sitting in the refrigerator, eating cake, and having something to drink. And it's a slice of life. It's the art of every day. So the I think having a range of folks from different backgrounds and out in nature or within home environments or in urban environments, just seeing all of those different slices of life, that was a real motivator in picking such a broad spectrum of art for the show.
I know you mentioned a good chunk of the pieces have already been sold, but for the pieces that are still available, what sort of price ranges should people expect?
So it, just as I said, because we have from school age children to professional artists, there are pieces in the low hundreds to the low thousands. So there are some pieces from professional artists that are a little bit more high end, but there really are accessible pieces for almost everyone within the show.
And I know this exhibit comes a few months after Novant's launch of the Art of Remarkable Care initiative. How is that initiative connecting Charlotte's art community to the medical needs of the Queen City?
That is such a great question. I think sometimes people don't expect art to be a part of healing, but evidence shows us that beauty inspires healing. It can bring calm, that working on arts projects and being involved in the artistic and creative process works well with our neural pathways and can create a sense of peace, reduce anxiety, that being in community of art reduces loneliness and depression. And so we think of art as a healing tool. We use it within our integrative medicine clinics already. And so we already knew that art was a tool of healing. by bringing the community in and demonstrating that this is a part of our care, this is a part of what we believe to be important to the healing process, we hope it encourages people who might be nervous. It's sometimes scary to come into a hospital. You think treatment might be white blinding lights and plain hallways. And really, we want them to know that our environments are actually made to be inviting, to be welcoming, and to be healing. And that we do that not just by ourselves, but through our community, that everyone is represented and a part of our healthcare process. And art is a way that we can express that passion and that commitment.
You just touched on this a bit, so that's great. But would you say, or why would you say it's important to bring art and creativity into spaces like hospitals?
Yeah, I mean, first of all, as I said, it is evidence based that art contributes to healing. But also, we are a part of the community at Novant Health. We are here to, to bring healthy experiences and create healthier futures for every single member of our community. And we realize that only small percentage of your health is driven by what happens when you walk into our doors. There's also all these other pieces that determine your ability to thrive. And so when we thought about the art of remarkable care, we really thought about how do we support those other parts, those economic drivers? We know artists work really hard and that it can be hard to find places to display art or to find the right audience or to be respected professionally. And so we want to think about the whole person and to demonstrate our commitment to being an economic driver in our communities, as well as interested in more than just needles and stitches. We have a broad way of approaching your healing and approaching your care and seeing you as a whole person, not just a number on a chart, but as an important piece of our community.
Are you able to talk a bit about what's next for the initiatives and
Of
Novant's artistic
course.
efforts?
So we have really looked at this initiative as being hyper local. It's already local because it's going to be primarily focused here in Mecklenburg, kind of ranges up from Rowan County down to Union County. So it was already going to be local and all of our artists were going to be local. But we've gone and now had meetings with Charlotte is Creative and each of our hospital presidents in Mitt Hill, in Ballantyne, Matthews, up in Rowan, of course at Presby, Maine, at Presbyterian Medical Center in Center City, Charlotte. And we've asked them, what moves your local community? What's important here for you? What would be special in your facility? And we're now actually putting pen to paper and creating a tailored plan for the next year to continually bring arts activities, projects, visual representations, and performance art into our facilities. So each and every facility within our footprint in Charlotte will have special activities. Many will be open to the local community. So stay tuned. Our next big event actually is happening on June 13th, open to the public in partnership with the Charlotte Symphony. We will be at our Michael Jordan Clinic on Statesville Road at next Friday at 7 p.m. Everyone is welcome to come out. We're having a concert. The Symphony's mobile pop-up stage will be there. Over 30 live musicians, no cost. Our mobile health unit will be there. You can get a screening, check your blood pressure, A1C. We want to make health accessible and easy and get people excited about accessing care.
That's great. Is there like a centralized calendar or place where people can find more events as they come out?
Yes, we have our website and we will make sure, I know Caroline will back me up, we'll make sure to get you our website. And of course, our announcement for our event next Friday is on that site. And you can check for details there as we continue to add more information about our events and activities that are coming up.
And is there anything else about the exhibit or the larger initiative that people should know?
You're just really excited. I don't know if you can tell him, but I mean, it's been such a great way to connect to a new part of our community. It's been such a great opportunity to kind of hear more stories and to hear stories from a different perspective. We hear people's stories from the hospital, but hearing people's stories of how art fits into that journey, I've been surprised and really inspired by how people's dance or musical performance has been a part of even their personal healing journey. So it's been a learning opportunity, I think, for all of us. And we can't wait to see it continue to grow.
What has your favorite part been of being a part of this experience and initiative?
So, I spend a lot of time in offices and meetings, on phone calls, which I love. I love meeting with community stakeholders and being a part of the work. But I get to be a little creative. So I really love being able to participate. I am one of the folks who purchased art from the Presby Gallery already. we are, being able to participate in this part has brought creativity even to my own life. And so my favorite part is just being a part of it, meeting the artists and opening up something new in our life. And we hope that happens for a lot of our team members. They work so hard, our doctors, our nurses, our environmental services folks, our cafeteria workers. We want to give them something fresh and exciting as well. So this is also something that impacts team members, and it's impacted me personally.
That's great. Well, those are all my questions. Is there anything else that I should know?
No, but we will, like I said, we'll make sure to get you specific details on the event and get you our website so that if people want to kind of find out more details, I think that's all that we want to make sure you know.